Greetings and welcome to Session 7 of the Public Health Surveillance course. We'll be focusing on evaluating public health surveillance systems. But before we jump into the content for Session 7, I just want to cover a couple of issues related to the midterm exam and what to expect. The midterm exam is coming up in the next session after this one. It'll be available from 12 a.m. on October 14th to 11:59 p.m. on Sunday, October 20th. This is an open book style exam, take-home exam. You're not allowed to consult anyone, though, and there are instructions about this that you need to adhere to. Once you start the exam, you'll have about 2 hours to complete it. Importantly, though, before you start the exam, there's an article that you'll need to read and answer questions about during the exam. So you don't want to waste any of the time, the 2-hour time slot on the exam while you have to read this article. So we've set it up so you can read it in advance of the exam. So there will be a link there. And the recommendation here is that you download the article, print it out and read it, make any notes that you might need before you actually click the link that starts the 2-hour clock for the exam. So that's very important. It'll save you a lot of time and make sure that you have enough time to complete the exam. And to be clear about the content, the midterm exam will cover information from sessions 1 through 7. So please be sure to review the instructions that are in the folder for the midterm exam before you start. And I also want to say that Session 7's content, which is focused on evaluating public health surveillance, the content and the readings and the exercise that we're asking you to complete on your own are very relevant to the midterm exam. Also, I want to just touch on the reaction papers. You all submitted your first reaction paper this past week, and I read them all, and I was very excited to read them. I thought that you all did a great job on summarizing the readings and identifying themes and some key questions. And I just wanted to mention a few things and tips that you could apply to the next iteration of the reaction papers, because we do have 4 more left in the course. First, be sure to cover all of the readings in your paper, not just a subset of them. And you should also cite these readings using reference management software from not only at the end as a bibliography, but from within the document. Most of you did that, but some of you did not. And also, importantly, try to avoid summarizing each reading individually. I mean, sometimes you have to do a little bit of summary in order to make your point. But the main thing about the reaction papers is to identify and write about some of the themes that you see across the readings, and importantly, relate them to the larger course content and concepts. So in the case of last week's reaction paper, which was focused on surveys and behavioral surveillance for behaviors and risk factors, it would be, I think, important to talk about how, the traditional surveillance systems that we've been talking about, such as notifiable disease surveillance and vital registration and things like that, don't necessarily capture some of this information on behaviors and risk factors, and that these are important for public health surveillance to capture, and so this is where the articles sort of fit in, and many of you did a great job with this in your reaction papers, is to talk about some of the design issues and some of the inherent challenges as it relates to trying to get representative estimates of behaviors and risk factors, that are often self-reported, et cetera, et cetera. So try to contextualize or start out maybe in the beginning of each of your papers with where this week's readings fit in to the larger arc of the course content that we're covering. I think that's it. I want to thank everyone for great submissions, and I look forward to the next round of reaction papers. Okay, as part of this week's session, there's an exercise that you can take that brings you through the process of evaluating a surveillance system. In the past, this is when we offered the course in person. This is something that we would do in class in small groups, but since it's online, this year, what we'll ask you to do is to complete the exercise on your own and then use what you've learned and maybe questions that came up as part of your as part of the process of completing this exercise as the basis for your discussion board posts. For this week. So here's the scenario, and this is also included along with some other information that you'll need in the document on Blackboard. You've just been hired by a health department to work in the communicable disease program, and you've been assigned to work with epidemiologists on the surveillance system for Salmonelosis, which is a disease often associated with foodborne outbreaks. Salmonelosis is a reportable disease in your health department's jurisdiction, and both providers and laboratories are required to report all new diagnoses and isolates, respectively. While the system is passive, during possible outbreaks, health department staff may send out notifications or alerts to providers and laboratories, reminding them of the importance of reporting cases. All cases reported to the health department are interviewed by a public health epidemiologist to ascertain symptoms, date of onset, and the potential exposures, such as foods or food sources and occupation. The current stated objective of the surveillance system is to prevent and control salmonella-associated foodborne outbreaks. And your task in this new job is to conduct a formal evaluation of the salmonella surveillance system. So the document that will walk you through the process of this evaluation is on Blackboard. And a couple days later, I think towards the end of the week, the answer key will appear, but the idea is for you to first do it on your own and begin to include some discussion board posts on this exercise on Blackboard in advance. And the other thing to remind you is that this is an exercise that will be useful to you as you prepare for the midterm exam, which, as you know, will be coming online on late Sunday night. In this session, we'll cover the rationale and give you some guidelines for evaluating public health surveillance systems. This is a really useful skill to have if you're working with a surveillance system, both to get oriented to a new surveillance system that you might be working with for the first time, as well as to work with a surveillance system that you have been working with for some time, but to evaluate whether or not the extent to which it's serving its purpose, achieving its goals, etc. And there's some very clear and detailed guidelines for doing this kind of work, which is as I mentioned, you'll find very useful. And just to drive the points home, we have for you to complete on your own time at the end of the session a self-administered exercise on evaluating a surveillance system. And as I mentioned, this will be very useful for you to drive home some of the concepts and the approaches around evaluating surveillance systems as well as for the midterm. So as we've mentioned before, the goals and objectives of surveillance, the public health landscape, and the surveillance systems themselves can all evolve with time. And so that means it's useful to engage in periodic evaluations of surveillance systems. And so this is the reason to do this, is to identify and recommend ways to increase the efficiency, the quality, and the usefulness of surveillance systems as it relates towards the achievement of their goals and objectives. And as you saw in your readings, there are some very detailed guidelines for the process of evaluating public health surveillance systems, and we'll be going through these in detail for this session, beginning with the process of engaging stakeholders, and then describing the surveillance system, including some details around the health importance, its legal mandates, the purpose and operations of the system, and the resources required to operate the system and maintain it, and then some considerations around focusing the design of the evaluation, gathering credible evidence on the system's performance, which would involve describing the level of usefulness of the surveillance system, and then going in attribute by attribute around surveillance system attributes. And then all evaluations of surveillance systems should justify and state conclusions of their evaluation work, and this sets the basis for making recommendations about how the surveillance system should change or evolve as a result of that evaluation and the conclusions that were drawn. And finally, it's important not just to make these recommendations and state the conclusions and put your report on a shelf, but then to get out there and ensure the use of those findings and share the lessons learned, so that folks involved in the surveillance system can begin to take some of those recommendations and put them into the form of action to make the surveillance system more useful going forward. So all surveillance systems have stakeholders, people who have some stake in the operation and the use of the surveillance system. And it's important from the outset to engage stakeholders early on in the evaluation process. But let's first define stakeholders. These include any persons or organizations that might find the information from the surveillance system useful or for their own work or for the purposes of health promotion. And stakeholders can include, in addition to the health department, other government agencies such as the Department of Education, community-based organizations, healthcare providers, community representatives, elected officials, etc. And it's including those who do the data collection as well as those who contribute to the operation of the system, but also those people who are consuming information that the system generates for one reason or another. The main reasons to engage stakeholders early on is to really help you identify the most appropriate evaluation questions and to ensure that the evaluation findings will be useful not just to you, but to other stakeholders in the surveillance system. It is a lot of work to undertake an evaluation of a surveillance system, and so this step as one of the firsts in the process of evaluating a surveillance system is really important. Next, you'll want to spend time describing the surveillance system as it is today, and that includes some of the things listed here, things that may have changed since the surveillance system was established, including the health importance of the disease or the condition or health-related event that's under surveillance, the legal mandates, the purpose and operations of the system, and the resources required to run it as it stands at the time of the beginning of the evaluation, or the time immediately leading up to the beginning of the evaluation. And we've talked about different ways of describing health importance or quantifying the burden of disease. But here is a slide, and also how these things can change over time. And here's a slide showing the leading causes of death. So one way to begin to describe the health importance of the condition under surveillance is to reflect it in terms of where it stands in the cause of death rankings for the jurisdiction, or numbers of death or death rates and things like that. And there are other methods of quantifying the burden of disease. If it happens to be a condition that tends to affect younger people, so it may not be something that causes a lot of deaths, or in terms of its ranking in the top 10 or the top 5 causes of death, but it may be something that affects young people, and therefore other methods to quantify the burden of disease or the health importance might be useful, such as something we've covered before, years and potential life lost, to sort of reflect the health importance of the condition under surveillance. This is just a slide from the Global Burden of Disease projects showing a visualization about years of potential life lost for various different diseases. The New York City Health Department has a Take Care New York plan, which outlines a number of areas for health promotion. And if there is such a plan like this in the jurisdiction where you're working with, you can talk about where the surveillance system that you're evaluating fits into this plan, or if it does not, why you're still considering it as potentially important surveillance system. But you can couch the health importance of the surveillance system in the larger landscape or list of priorities that the health department may have. In the example of measles, this of course has become an even more important health priority than it has in the past. So it wouldn't be difficult, of course, now to justify a surveillance system for measles, or to state the health importance of measles as you embarked on an evaluation of the measles surveillance system. But I include this slide here to think about, those days, like, for example, in the late 90s, where there were very few cases of measles happening. And measles is a vaccine preventable disease, and so the health importance does not necessarily only need to be reflected by the occurrence of that health event. You can also think about things like measles, which are of great health importance because they're preventable, and even when the health system is doing a good job at controlling or preventing that condition, there still needs to be a surveillance system to identify, when things begin to go wrong, or when there might need to be responses in the form of, public health response or outbreak detection and response. Surveillance systems are important for those reasons as well. So the health importance of measles, for example, notwithstanding our latest outbreak, even when the number of cases are low, is quite high, and this can be justified in terms of the need to continue to prevent and control certain health outcomes. As part of your description of the surveillance system, it's important to delve into the legal mandate. What is the legal or regulatory basis for the surveillance system? What are the laws and regulations that require its establishment? They may or may not exist, and if they don't exist, what's the basis for the system? And then also related sometimes, how is the surveillance system funded, and who funds it? With regard to legal mandates, we'll be having, after the midterm, an entire session devoted to the legal basis for a surveillance system. So we'll begin to get a sense of that at that time. Central to the evaluation of any surveillance system is to describe the system's objectives. Now, these may be stated, and they may also not be relevant anymore, or they may depend on who you ask in terms of the stakeholders and other people involved in the surveillance system. And all of this sort of information, as you gather early on in the process of evaluating the surveillance system, is important. It may be that the objectives of the surveillance systems the objectives are something that need to be reconsidered or reassessed or need to change. So it's helpful to talk to people about what they see as the objectives of the surveillance system. It's important for you as the evaluator to take a look at all of the evidence and everything you can learn about the surveillance system, and try to discern what the objectives are. And if you're lucky, although this isn't always the case, you may even find it written somewhere what the objectives of the surveillance system are. And all of these things need to be sort of taken into account at this stage. But some of the things that you might be considering, or some of the things that you might see as people talk about the objectives of the surveillance system, are listed here. There are, and we've talked about these in prior classes, so they shouldn't seem unfamiliar to you. But there are many different kinds of objectives that surveillance systems can have, and some surveillance systems can have multiple objectives. And we've covered a lot of the operational issues related to surveillance systems in prior lectures and readings now. And so when it comes time to characterize the operations of a given surveillance system, you know that these are some of the things that we're thinking about. What are the case definitions? Is the case definition practical? Does it need to change? What's the population under surveillance? What kind of information is collected as part of routine surveillance? What are the data sources or the reporting systems? Who's expected to report? And then what happens after that? How are the data handled? How is confidentiality maintained? How are the data analyzed and disseminated? Does it get to all those who need to know, including the medical and public health communities and policymakers and other stakeholders in the surveillance system? So these are the kinds of things that you're going to want to characterize as the operations of the surveillance system in the evaluation process. And operations, of course, is where you get into a lot of the nuts and bolts of things. What are the procedures? You want to get copies of all the forms. And get into really some of the details that are necessary to really understand how this surveillance system operates on a day-to-day basis. And also, you're going to want to get copies of any dissemination reports that go out, like if it's an annual report that the surveillance system disseminates, or whether it's semi-annual, or you may find that they haven't disseminated in quite a while. But you're going to want to do this kind of digging to understand how the surveillance system actually operates. And at this point, it also becomes useful to think about, a visual or flow chart of how the surveillance system operates. Beginning with the occurrence of the event under surveillance, and then all the way to the point of disseminating some of the information. Having this flow chart is useful for you as the person who's evaluating the surveillance system, but also as you're talking to other people who are involved, to continue to build and add detail to your understanding of the surveillance system. It's something that you can use and show to people and confirm that your understanding is the same as theirs as far as the operations are concerned. And we've seen this flow chart before, but just to give you, just to revisit it, actually, this is a flow chart that I created in the process of evaluating the surveillance system for HIV/AIDS in New York City, and this is the level of detail that it really does help to sort of get into when you're going through this process. And another surveillance system that I was involved with that I was trying to understand, it became helpful to work on the flow chart for how the surveillance system works. And so this was made for the village level activity for guinea worm. And you can see what happens when guinea worm cases occur, and also how prevalent cases are found. And it goes all the way to the point of data cleaning and data entry. And then seeing how this larger surveillance system for one local government area fits into the national surveillance system. And part of the question related to the resources required to run the surveillance system relate to costs. And this includes the direct costs of the surveillance system, and which are usually mostly personnel, but also some financial resources that are expended to maintain the entire breadth of the system, from data collection all the way to dissemination. And it's also useful to assess the cost against the system's objectives and usefulness, and against the expected cost of possible modifications or alternatives to the surveillance system. So you can think about things like the cost per case detected, or the cost per case treated or prevented, things like that. If the goal of your surveillance system is about disease control, you can think about relating the cost to some of the system's key outcomes. And you'll recognize this slide from a prior lecture about it really reflects a cost analysis of different scenarios and different ways of running a surveillance system. The cost of running an active surveillance system for hepatitis, or a passive one. Once you've done some of this background work and gathering of information, and sort of spending time understanding how the surveillance system works in its current state, you can begin to think about like what the design of your evaluation will look like, how it will address some of the key questions that you're setting out to address given the current state of the surveillance system as you understand it from this prior work. And at this stage is where it becomes very important to be very clear about the questions in the evaluation, or the questions that the evaluation will be designed to answer. What are the key important questions that you have discerned through this background work that has been done up until this point? Once you've, and then think about a design that is capable of answering those questions or providing insights as it relates to some of those key questions. Who will receive the findings and the recommendations of the report? What will be done with that information? And before you go, collecting, before you go about the process of collecting additional information to address some of the questions, it's important to identify upfront what are the standards, what the standards will be for assessing the surveillance system's performance. And once you have your questions and the design, then you can move into the phase of gathering credible evidence on the system's performance. And you'll be describing things like the level of usefulness of the surveillance system. And you'll go through a series of surveillance system attributes, which we've covered and we'll revisit briefly in the coming slides. So related to usefulness, what do we mean by that? Does the surveillance system actually make a difference in public health practice? So you're asking questions like, what actions have been taken to date as a result of information from the surveillance system? What information has been disseminated from the surveillance system? Who's used the information to make decisions and take action? What other future uses might the information from the surveillance system have? And the usefulness of the surveillance system is influenced greatly by its operation, its operations, including the feedback mechanisms to those who need to know, and by the system's attributes. Here you can also think about whether or not, in your view, the surveillance system has been sort of underutilized. In other words, there's lots of potential for it to be useful, but has it been really achieving that potential, or to what extent is there improvements that can be made? So other questions you can ask when assessing the usefulness of a surveillance system: can it detect events in a timely enough manner to permit prevention? Can it estimate the magnitude of the public health problem and identify risk factors? Can it monitor trends over time? Does it stimulate research that leads to disease prevention and control? Does it permit assessment of the impact of prevention and control measures? And does it lead to improved clinical, social, policy, and practice outcomes? This is a slide that I think demonstrates the usefulness of one useful aspect of the HIV and AIDS surveillance system. So it's showing here the number of cases of HIV by neighborhood, or by zip code in this case, among people who inject drugs. So the red areas of the map show those areas of the city where there are greater numbers of people with HIV who also inject drugs. And the yellow dots are overlay the map show places where there are syringe exchange programs that people who inject drugs can use in order to prevent transmission of things like HIV or hepatitis. And this is like what I would call a classic gaps analysis. So it shows the areas where there are needle exchange programs lined up with the larger numbers of people with HIV who inject drugs. But you can also see that there are lots of areas on the map that have high numbers of people with HIV who inject drugs where there's no needle exchange program nearby at all. And this map was used by the health department and our commissioner to advocate for the strategic placement of new syringe exchange programs where there was unmet need. And so this is I think a great example of how a surveillance system like the HIV/AIDS surveillance system has shown, demonstrated its usefulness. And so the idea is to try to find examples like this, as many as you can, when you set about to describe the usefulness of a surveillance system. And then you'll be going attribute by attribute through this list and describing as you understand it, or even collecting information, and qualitative or quantitative information, to characterize each of these system attributes. And so you should endeavor to have something to say and maybe some data to show for each of these attributes as much as possible as it relates to your evaluation. So a fair bit of time is spent in this part of the process looking for evidence to describe how the system performs as it relates to each of these attributes. At the end of it all, you will have gathered a lot of evidence and anecdotes and perspectives, and you will then be in a position to identify the conclusions and justify them. Those conclusions that flow from the data you've gathered and analyzed about the surveillance system. And so you'll have conclusions that are based in evidence and data that you've gathered, and you'll then be in a position to make recommendations that are supported by those data and the evidence that you gathered. So some of the kinds of conclusions that you'll be drawing should relate to the present state of the system, not going too far back in time, especially if the surveillance system has changed or evolved. You'll be speaking to whether or not the system is addressing an important public health problem. You'll make recommendations for how to improve the surveillance system, including how you might be able to improve its efficiency and its quality. Also keeping in mind that any recommendations you might make regarding a focus on improving a particular attribute usually means that there's going to be a trade-off. For example, sensitivity and specificity, or positive predictive value. Working on these, improving some of these attributes often come at the expense of others. And your recommendations should focus on the areas that will help enhance the ability of the system specifically to achieve its objectives. So you can make lots of recommendations about how a surveillance system could be better, but the goal here is to focus on those recommendations that will strengthen the system's ability to achieve its core objectives. So that means you'll often be identifying what some of the limitations of the surveillance system might be, or you'll be focusing on what some of the limitations that you've identified as you've gone through the process of evaluating the system. So here are some of the common things that you might come across and that we've touched on in some of our earlier sessions. Underreporting of the event of interest, or incomplete reporting, a lack of representativeness of the cases in the surveillance system relative to the cases that are occurring in the entire jurisdiction, a lack of timeliness or inadequate timeliness, An inconsistency of case definitions, or how a single case definition may be applied inconsistently in different settings across the jurisdiction. Incomplete or inaccurate information on case reports. So you're expecting to get data on 15 different elements from providers when they report to you, but on average, it's only complete. You usually get about 6 or 7 of them. And lastly, the potential for bias in the data represented in your surveillance system as it relates to the what's going on in the larger jurisdiction. But again, these limitations need to be considered also in the context of the surveillance system's objectives. It's possible to have a surveillance system that's quite good at achieving its objectives, even though there might be incomplete reporting, for example. And in terms of your recommendations, they'll often fall into a number of different categories. And here are some general strategies that have been used to improve surveillance systems. So improve the completeness of case reporting, and that can happen by giving more attention to the infrastructure that's used to file and process case reports, increasing the awareness of providers and training of providers on the process of reporting. You can simplify the process of reporting. So, for example, moving from a paper system to one that is based on internet, that can be done through online means. You can think about tapping into new data sources. For example, if your system has only relied on provider reporting, it may be that there are laboratory tests that you can begin to think about tapping into. And there are also increasingly, electronic data sources that can be leveraged, such as electronic medical records or laboratory databases. On the data use side, there's often improvements that can be made in terms of how the data are analyzed and processed that health departments can work on. And that also can mean better use of design or use of the information systems that they use to manage the surveillance data. In terms of increasing the completeness or timeliness, you can think about transitioning systems from ones that are fully passive to something that is closer to active, or a hybrid of active and passive. Of course, this is not going to come without a need for more resources or reprogramming of resources. And another common weak link, and something that can be improved and can often make a lot of difference, is to increase the dissemination process, to make it more systematic, to make it more useful, and to make sure that it includes the kind of information that surveillance system stakeholders are looking for, the things that they think will be more useful to what it is they view as the goal of the surveillance system. Lastly, you and your colleagues have done a ton of work researching the surveillance system, understanding how it works from the ground up and the inside and out, and collecting data and processing that into information that you can use to make conclusions and make recommendations. Now it's time to ensure that other people are aware of these findings, and that they can be taken up and actually result in some positive change to improve the surveillance system and help it get to be more effective or more efficient at achieving its goals and objectives. So this is a good time to go back to those stakeholders that you met with initially to sort of get a sense of their perspectives and perceptions of the usefulness of the surveillance system and its objectives, to go back to them and report back and let them know what you found, and talk about some of your conclusions of what you think are some of the key recommendations and how they might be implemented. And this is going to require a lot of follow-up on your part to engage them. And then think about how best to tailor the findings and recommendations to the relevant audience. Some of the recommendations might be targeted towards providers. Some of them might be targeted towards internal health department staff who are, working closely on the surveillance system from a day to day. But be sure to frame these recommendations in terms of the gains and trade-offs, so that people can make an informed decision about whether and how to implement or not implement specific recommendations. It's always good to have a written report of the evaluation that you've done, and you can take it further and go do oral presentations or publish journal articles in peer-reviewed publications. This is helpful not only for the jurisdiction where you're working, but it's a chance to disseminate information about your surveillance system and some of the important lessons learned beyond your jurisdiction. And I can guarantee that other jurisdictions will find this kind of thing, very useful. It will save them a lot of time as they and maybe even spur them on to do similar evaluations of their own surveillance systems. Back in 1999, we set up a surveillance system in the middle of an outbreak for West Nile virus that was about trying to identify those cases of West Nile virus that resulted in hospitalization. And afterwards, after we collected all the data, we went back and did sort of an evaluation of how that surveillance system performed. And in the process of setting up that surveillance system, we identified 719 cases over the course of a few months. Or 719 reports that came to the health department that met our case definition. And then those individuals were subsequently tested for West Nile virus. And so we had the opportunity to look at different aspects of our case definition to see, where we were getting more or less yield. And what we found was that if we focused more on the encephalitis cases, we'd have a higher hit rate, a higher positivity rate than we did just for those cases that had meningitis. And in the lower part of the table, you can also see that focusing on younger persons that met our case definition really didn't identify it didn't really have a high positivity rate, but older persons did. And so that helped us refine the case definition for future surveillance for West Nile virus to make it more efficient. And it also helped other jurisdictions who needed to set up surveillance systems for West Nile virus. So that's an example of how you can disseminate some information about your evaluation that might be useful to your jurisdiction as well as to others. So a couple of concluding remarks and pro tips. So if you are beginning to work with a new surveillance system, say it's your next job and you're working on a surveillance system that you're unfamiliar with, ask if there have been prior evaluations, and if they are available, review them. These are one of the fastest ways that you can learn about a surveillance system, how it works and what its limitations are, etc. And if your health department doesn't have one, you can also look for formal evaluations that have been done of similar surveillance systems at other health departments or maybe by the CDC. And moreover, if a new evaluation of a surveillance system that you're working with isn't warranted, you can still conduct your own evaluation as part of your process for getting yourself oriented to the system. It doesn't have to be a full-blown one, but going through some of these steps, some of these guidelines, just for your own purposes can be really instructive and help you really get up to speed about how a surveillance system works. And lastly, the principles and guidelines that we've outlined here in this session really apply not only to surveillance systems, but to a lot of other public health systems that you may encounter in your careers.